Hey, Sandy here and another My Mom Glow Quick Tips. So today I want to talk about something that doesn't always get talked about, and usually depending on the scenario, the situation, or the environment can change, right? So usually when we think of fetal heart tones, we usually think of a fetal Doppler. So this is the most common way to listen to the baby's heart tones. Basically what happens is a little bit of ultrasound jelly is put on the end of this. This has a speaker, and usually when we listen, it's amplified through it. So you'll hear, usually that's what it sounds like. And then moving around, sometimes a little kick we can listen. That's probably the most common. Usually even in the hospital settings, they can use this during prenatal appointments, but in labor, they'll usually strap the mom with two bands around the abdomen. One will be for the fetal heart tones and the other one will be for contractions. But in an out of hospital birth, this is what midwives use for even water birth and labor in general, right? Now, the other tool that can be used during prenatals is called the fetoscope. It is a small listening device that basically you put it on like a stethoscope. So I put it on like this, and then this part goes onto the belly, and we would go really closely in and kind of find where that heartbeat is, and then we would be able to count. Now we would listen to movements and heart tones. A lot of times we're the only ones that are listening, so we would have to hand this over to mom or the partner so that they can listen as well. So this is another way to listen to the baby's heart tones when moms don't want to use the fetal Doppler. And then there's the Pinard horn. So the Pinard horn is a more traditional tool that's been used for generations to listen to baby's heart tones. There's a little hole back here where we would put our ear, and then this part is put onto the belly and it amplifies the sound through here. Now, this is typically found in other countries, but it is just another tool that we can use to listen to the baby's heart tones. So, each tool has a purpose, and as midwives, we choose based on the situation, based on the environment, and based on the mom's choice. So if a mom is choosing a fetoscope, then it is her choice to listen to her baby that way. If a mom is choosing the Doppler, then it's her choice to listen to that way. Now, just one of the things as far as like prenatal care, if you are seeing a midwife, most likely can't listen to the baby until 20 weeks with the fetoscope because they're just so tiny. It's really not able to catch the sound. So usually they'll listen with a Doppler in the beginning, and then they can switch over to the fetoscope. And then depending on the midwife and the scenario, sometimes they will be okay with using that in labor, but I would say the majority of midwives like to use the fetal Doppler during labor because labor is very